Okay, we're going to move into our next panel, which I am privileged to be here to lead. And I'm going to ask Bob Perkowitz and Sabrina McCormick to join us up here. Sabrina, you're here. Bob, you're over there. Bob is the president and the founder of ecoAmerica. He sits on the board of the World Bicycle Relief. He has done an enormous and distinguished number of things in his career, committed to the environment and focused on climate change. So, Bob, it's good to see you, and thanks for being here.
Thank you, Frank.
Sabrina McCormick is my idea of the trifecta person, okay? She's a scholar, a sociologist, and a storyteller. And it just doesn't get much better than that, because not only can she teach, but she can preach. And she can, and she does it.
I try not to preach.
Well, not preach, but preachers are storytellers, and that's what people remember. And we're going to be talking about all of that. I'd like to dive right in here with you both on the connection of what the senator was just talking about, climate change and health and public health. And Bob, why don't you start, because you and I were talking and some time ago when we were talking about what we were going to bring to the group here today, and you went right to the vast number of organizations, many of which you work with, who are looking at this very issue. And yet that's under the radar for a lot of people. And think about what the senator was just now talking about. So what are you seeing out there?
Well, the public health community over the past 2 or 3 years has made a big shift to addressing climate change. If you went, let's say, January 1st, 2015, the American Public Health Association website didn't have a climate change feature there. It was on a separate website. Now on the pull-down menu for APHA, the #1 issue is climate change, right? They have declared 2017 to be the year's theme, Climate Change, the Global Health Challenge. Their conference is coming up in Atlanta in 3 weeks. There are 220 sessions on health and climate change.
220 sessions?
220 sessions, or about 44 last year, there's 220 this year. The whole conference is themed on climate change. So the whole profession, you know, if the APHA doesn't say it's an issue, then if you're in public health and you're a state public health official or whatever, you know, you don't.
What are they looking at in particular? What are they taking apart with 220 different sessions?
There is, well, there's all the different health impacts of climate change: anxiety, asthma, vector-borne diseases, heat-related strokes, mental health impacts. There's multiple sessions on those. Health disparities, communities, and public health and climate change, and what you can do about it. It gets down to a lot of very specific things in those sessions, but a lot of them are contextual.
And in the public health area and health area too, this is very interdisciplinary. We're seeing this with pediatricians and allergists, the whole bit.
If you go to the American College of Physicians, if you go to most of the major nursing associations, if you go to the, as you said, the American Academy of Pediatrics, they are going to do a global children and health climate summit next spring to bring together people all around the world to try to figure out what to do to the health impacts on children.
Is their work, Bob, and their study prospective, in other words, anticipating these effects of climate change? Or is it a snapshot of what we are already seeing and trying to both assess and treat current existing situations?
All of the health impacts of climate change are already visible and out there and accelerating. People are trying to figure out how to address the problem more than anything else. How first address the first order problem, which is heat and climate change, but then also to address like what happens to communities for, let's say, like Puerto Rico, as the senator mentioned. You know, the health impacts on that are unbelievable, and the mental health impacts on it for many of those people are going to be permanent.
Sabrina, you are, as I mentioned, a sociologist. Sabrina's also a filmmaker. If anybody's seen the series that was, it's now on National Geographic, Years of Living Dangerously, she's contributed to that and worked on that. In your academic work, you investigate what motivates climate awareness, mitigation, adaptation, all of these things. Do people from your work realize and appreciate how tied public health and their own health is to climate?
No, I mean, I have to say it's kind of shocking. As someone who's worked on public health and climate change for over a decade, you know, when we interview people about what climate change means to them and if they're at risk from it, they say, A, no, they're not at risk from it. Maybe their children are. And when I say people, I'm talking about Americans. Maybe their children will be at risk from it, but it's always somebody else, somewhere else. It's never me, and it's never health. However, I will say, and this is a more hopeful message for those of you who are interested in sharing messages about climate change and health, when you show them, oh, asthma is going to be exacerbated by climate change, oh, heat actually leads to, extreme heat leads to higher death rates, et cetera, they tune in. And they tune into those messages a lot more acutely than they do to other kinds of messages. So when you talk to people about the health ramifications of climate change, you begin to peel back the layer of, okay, it's not just that the hurricane leaves us with billions of dollars of property damage, it leaves human damages and damage on human lives, livelihoods, long-term, as was already begun to be mentioned, long-term health effects on our mental health and well-being. When you start to peel that back and create those human messages, people really do tune in a way that they don't otherwise.
And what does that conversation sound like? I mean, is that taking to somebody and telling them that they are at risk? Is it showing them what's already happening or changing in their lives and they realize it themselves? In other words, how do you communicate that to get someone to that point of realization?
Well, you know, I think we're still very, I mean, speaking from the perspective of both a filmmaker and a researcher, we're still very early days trying to figure out how to really tell those stories well and loop people in a very effective way. But what I've seen is, you know, when you and I talk about it, and we're friends, we're colleagues, you're much more likely to listen to me talk about it than say, you know, somebody standing up.
I'll believe anything you say, Sabrina.
Love it. That's amazing. We're going to have some more conversations later. You know, so these messages coming from people who you care about, right? That's much more powerful than, you know, even an expert, right? I mean, sometimes we do actually, Americans, well, it depends. I should speak more specifically. Some Americans really do listen to scientists and believe what they say, and that's a credible messenger. But sometimes it's just a friend or family member, so that's one thing. Speaking from a filmmaker's perspective, when we tell a compelling story in which we see somebody who's actually been affected by air pollution that's gotten worse because temperatures have gone up, then people resist, especially if it's children, actually. Children are just one of the best messengers. We start to really care and tune in. So there's some of the ways.
How many in the room are scientists? How many in the room are fortunate enough to be married to scientists or be a parent of a science? Or okay. How many of you are in public health in one form or another? Pretty much everybody. Okay. So Sabrina, do people in health care and in public health make the connection to climate change?
I mean, okay, I'm going to give a little quiz. So 2003 heat wave in Western Europe. I'm going to give you three choices. How many people died? Choice one, A, 200 to 300 people. B, let's say 1,000 to 2,000. C, 35,000 to 70,000. Raise your hand if you think it's A. Raise your hand if you think it's B. Raise your hand if you think it's C. All right, well, so these people are quite well educated, actually. So good for you. Congratulations. Because usually when I give that quiz to an audience, everybody guesses A. Everybody guesses A. Maybe a few people guess B. And C is the correct answer. 35 to 70,000 people died in that heat wave. But, you know, I'm giving talks all the time to people in the public health community, people outside of the public health community about making this link. And the link is really not yet made for them. It's really early days on broad-scale awareness about the health ramifications of climate change. And it's shocking to me because the science is pretty solid.
Let me ask both of you this question. This is very interesting, and you know, there are always parallels that are made. We think about the campaign against tobacco and what that consisted of and what worked and what didn't work. Similar lessons we try to learn in the campaign against obesity. Tobacco really broke through when it wasn't us telling you that your smoking would kill you, but when it was telling you that someone else's smoking might kill you, and this whole secondhand smoke thing. Do you know of public health messages that are out there that are being developed that relate to climate change that appear to work or appear to be persuasive?
Yeah, I think you're exactly right with your analogy to tobacco. It was, you had your personal right to smoke and kill yourself. But then it becomes secondhand smoke. Then it becomes secondhand smoke in your children. And then it becomes personally relevant to everybody. And that is really what you go for if you want to communicate to people. We've noticed in working with all the different health associations that if we're talking to mental health professionals, you have an entire presentation on the mental health effects of climate change, and they walk out and get it. If you're talking to the pediatricians, one slide on climate change, one slide on solutions, one slide on 23 slides with pictures of kids. Everybody walks out of that room and gets it. Same thing with public health. So what works is to be, is not the polar bears, it's not jobs in the economy, it's really personal relevance, what it means to you, your family, your community.
But isn't that the problem too? Because for most people, climate change is so distant, so out there, so not directly relatable. I'm living in Iowa, maybe Napa Valley's burning, but that's not me. And you can't actually tell me that Napa Valley is burning because of climate change.
That's why it's so important to engage the health community in climate change and in talking about climate change, because it's not a big leap to say, hey, asthma and allergies, the seasons are 60 days longer and it's 400 miles north of where it was 20 years ago. So twice as many Americans are impacted by asthma, allergy, vector-borne diseases, or whatever. People get that. And when you have solid, concrete examples all over the place right now, not to go to the senator's state, and excluding what just happened in California, if you take Montana and Idaho, an area of the United States the size of Maryland burned over the last 2 months, burned to the ground, right? But so people are hearing it in their daily news, and all of those things, that smoke, the burnt, health impacts are the best way to connect that kind of stuff to people.
Absolutely. And, if we look back to the National Climate Assessment that came out very recently, what the federal government has said to us is every region of this country is being affected already by climate change in many of these health dimensions. And so the evidence is very solid. And there are specific examples you can draw from. I don't care what state you come from. I don't care what region you come from. I don't care if you're affected by sea level rise or by wildfires or by hurricanes. Every region has some kind of effect from climate change that is affecting the public's health that needs to be acted upon. And that's just looking at the impact side, right? So let's back up and look at the drivers. So reducing greenhouse gases also therefore reduces airborne pollutants that then in turn reduce asthma rates, rates of cardiopulmonary respiratory disease, et cetera, et cetera. So there are co-benefits as well that we should really be pointing to, following up on what Senator Cardin was really emphasizing, which I very much appreciate, which is we can do something. Let's not just sit back and say, okay, well, Puerto Rico has been destroyed by this hurricane and we have to act, and we do. But we also need to act before that happens again and again and again.
So let me point this out. The Senator talked about the EPA. If you go to the EPA's website, you actually can still find a very interesting section related to climate change and health. And here are some of them, and I'd like to ask you about them. Air quality impacts. Ground level ozone can damage lung tissue, reduce lung function, inflame airways, can aggravate asthma or other lung diseases. Inhaling fine particles can lead to a broad range of adverse health effects, as we know. Impacts from extreme weather events, another area. Most people at risk here, include young children, older adults, people with disabilities, medical conditions, just getting out and getting around. Vector-borne diseases. Geographic range of ticks that carry Lyme disease, for example, limited by temperature. As temperatures rise, ticks likely to become more active earlier in the season. Range is likely to continue northward. I read the most disgusting article I think I've ever read about a moose and how moose are now getting attacked by these ticks. And they found one moose that had 100,000 ticks on it. And I think ticks are like God's biggest mistake ever.
I have a grosser one, if that's a word. More rats. The rat population being driven up by climate change. I just saw this article like 2 days ago. It's disgusting. Sorry, we won't go down that road.
So, continuing, Mrs. Lincoln, with the play, water-related illnesses. Climate impacts can affect exposure to waterborne pathogens and parasites, viruses. Food safety and nutrition. Higher temperatures can increase the cases of salmonella. Do we risk, with this kind of thing, scaring people to the point that they just tune out and it's more of the same because people hear this a lot? Or is this the way for health professionals and others to make a connection? Bob, what do you think?
Well, you know, you only, if it's something's far away and you can't do anything about it, it's really hard to act on it. And people are always told about climate change as a big, massive thing, and there's nothing you can do about it. And if you can convince them that the exact opposite is true, that everything that you do every day can have some impact on climate change, you can go immediately today, and this school is, Dean Golden's school, this building is a LEED building. You know, they're doing something about that. And I would not be at all surprised if we're not buying 100% renewable energy in this building. And right. So, but you can do that in your own home. You can go to your utility bill tonight when you go home and you can switch providers for an extra $6 a month and have 100% renewable energy. You can go out and plug in an electric car. Some of it might take a little bit of investment. Some of it might take a little bit of time, but active transportation, healthy, helps with climate change. Everybody can do a whole bunch. And that's the first thing that you need to do is make a commitment that whatever little steps I'm going to take, I'm going to do. And once you start doing that, then you become empowered and you become engaged and you stay engaged. But if you're not doing anything, then you kind of like, you don't, it's disingenuous, maybe it's hypocrisy to go out and tell people that you should do something when you're not. So
Sabrina, what do you think about that? What can and should people do?
Well, I do this. I teach a grad class, and I do this to my students. I make them identify something in their life that they know is a contributor to climate change. Start small, and then I make them act on it. And then track what are the obstacles in their lives to preventing them from taking action on this small thing. It's fascinating to watch that play out and the ripple effect one individual can have on their families, communities, neighborhoods. I mean, students have done things that I never expected, affecting whole restaurant businesses just because they decided to take one small action. And so I think that's incredibly empowering to just start very small and teach yourself you can do something. Having said that, I'm not one to say that we have to take the responsibility on only ourselves as individuals. I'm so glad that Senator Cardin was here because we need to be taking action on this at the policy level, which means we have to vote on these issues. We have to call our representatives. We have to make sure that we are educating other people to do the same. Because the fact is that without subsidies, as he mentioned, to renewables to the tune that the fossil fuel industry has been subsidized, it's going to be very hard for us to instigate the massive transformation in our economy that we must have in a very short period of time, which we absolutely could have in order to avert catastrophic climate change.
I would add one thing to this about what we can do, and you know this because you've worked with us, and some others may have as well. Kathleen Merrigan, I know, has, and that is, so I'm teaching a class right now over at the School of Media and Public Affairs on sustainability reporting, how to report and how to communicate these things. And this project that I started sometime here called Planet Forward is all about gathering people's stories. Tell your stories. When you do these things, find a way to convey it, not in a boastful way, but in an informational way. If you're a doctor and you're doing something with your practice and you talk about how you've made it more energy efficient, that's informational, provides both a model and information, right? Don't you think that leverages those actions that you're talking about if we then share what we're doing with others in the right way?
Absolutely. Like the concept of relevance is you almost always telling the story. It's not reciting a bunch of facts. So if you can have a story that relates that you have done, that someone else can see themselves. We always publicize success stories, best ideas, best practices, so that if you're a minister, you can give a guidebook and say, replace your light bulbs, insulate your windows, do this, do gardens, or you can show them another church where they're doing it and have them watch a 3 or 4 minute video of that story, and it's much more powerful to see it happen than to try to explain
Well,
it.
as we say in the media business, show me, don't tell me.
Show me, don't tell me.
So make it a story. All right. What is the role of the health and medical sectors then in achieving some of these climate solutions? As we think about what people can do individually, collectively, and in this line of work, what can people be doing? How could people leave this session with a couple of ideas for what they could try, implement, tell other people about?
Well, I mean, I think those who are experts in the health field are great messengers. And again, making it personal, making it connecting health to climate changes.
But does that mean, that doesn't mean wagging your finger and talking climate change every time you talk to somebody. So how do you do that messaging?
Well, I think it depends on the context and the audience, right? I mean, you always have to make your message, I mean, you know this well, make your message attuned specifically to your audience so that they can hear you, meet them in a place where they're at. So it's not to tell them, you have to stop, you know, that never works. I mean, try telling that to somebody who, you know, you want to do anything, that never works, right? It just to engage with them where you know they are. I mean, I think there are many ways to do that. It depends, very audience dependent. I think also, though, in terms of the healthcare sector, you know, the healthcare sector is one of the largest contributors to greenhouse gases in America. I think 13% of greenhouse gas emissions come from the healthcare sector. Is huge. So to begin to mitigate climate change by reducing greenhouse gases through the healthcare sector, I think is incredibly important.
I was going to say that the first and most important thing that everybody needs to do, you are experts, you need to get informed about the impacts of climate change in your profession, in your area of specialty, so you can become comfortable enough talking about them. And then once you have that, you know, nurses are the most trusted profession in America. Doctors are the second most trusted professions in America. I guarantee you, you know, public health people, if you're sitting in your city council meeting and you say, listen, I'm a little bit worried right now because, you know, it's getting a little bit warmer, a little bit more ticks, a little bit more fleas, a little bit more heat, and we got to prepare our community for that. We have to prepare our citizens for that. They're not going to say, you don't understand anything. You're the public health official and you're responsible for taking care of them, and they will listen to you. So be informed, share your stories.
Let me just push back.
Sure.
Because I don't know if this is going through anybody's mind, but I mean, I'm back to the, how do you handle this without getting caught up in the politics and the ideology that might be out there awaiting you? We had a meteorologist come and talk to us about being the weatherman on his local station, one of the most trusted figures in the community. He said one time he started talking about an extreme weather and climate change, he got more hate mail than he's ever gotten by people who were beating him up. My doctor tells me to put sunscreen on, sunblock on when I'm going out, but he doesn't tell me to put sunblock going on because climate change is happening. He's telling me because of the sun's UV rays and blah, blah, blah. To people who are going to become messengers and connecting public health and climate change, how do they balance this issue given the politics and the ideology?
Look, the majority of Americans believe climate change is an issue. The majority of Americans are concerned about climate change.
So don't worry about it.
No, the numbers have been going up. So no, I'm not saying don't worry about it. Again, we have to come back to this, your audience. You have to target your message to your audience, right? I mean, there is a debate about, do you have to talk about climate change, or you just tell people to switch to renewable energy because, you know, it's cheaper in some places, or because energy independence is important. These are messages that appeal to everybody, conservatives, independents, Democrats. There are ways to get people to address climate change without saying, you must do something about climate change, you know, decrease your energy bill. So it just depends on who you're talking to. But I do want to say that, you know, we have to give people the benefit of the doubt that they are going to be able to hear a message that, is actually true.
Are any of you concerned about getting involved like this, that you'd get caught in that whipsaw, or doesn't it? Does that not concern you very much? No? Does concern you?
Yes. Well, let me...
How to strike that balance, how to broach that subject. Right. I'm giving you medical advice. I'm not running for office kind of thing, or whatever it is. Yeah, interesting.
I was going to say that if you go to the ecoAmerica website, you'll see something called 15 Steps, and you'll see a guide to communicating on health and climate. We do meta-analysis on all the climate communications. We do focus groups. We've done hundreds of focus groups. We've done 10,000 people in dial tests. We test all the process of communicating and all the exact words that you do, and you can get a guide on the website. And I can tell you that if you have that issue with politics, start with people, stay with people. When you talk about it, don't talk about polar bears or abstract things, talk about people. The second thing is connect on common values. And my granddaughter is super. And then the third thing that you do is, and I've learned this hard way, is you always express ambivalence. Ambivalence is not doubt. Ambivalence is saying, some people think this and some people think that. Then you go to, but from my own experience. And then if you do that, then you know you're not conflict oriented. They know you're going to listen to them. They will listen to you, and you can have a productive conversation. But when you come up and you say, we really got to do something about climate change, Trump's an asshole. I mean, that's, the people that are hardcore environmentalists, those guys, a lot of them are getting fatigued at hearing that same thing over and over again. And the people that are, concerned, and don't know which way to go, they get concerned about it. Everybody gets concerned if you come on strong. So be respectful, talk about people, express ambivalence.
So if I go to your ecoAmerica, it'll tell me not to talk like that, right?
Yeah.
Okay. I better go there.
Except with the certain audiences, it works.
Okay. Do you have a question? Time. Sorry. All right. We need to wrap here. I just want to give each of you an opportunity to offer a closing thought to the group before we move on.
I mean, I guess the one thing I would say is, as you all continue to move forward in learning about climate change and health, is it's very easy, I think, to get overwhelmed and to feel like, wow, we're going to go down this road. The shit is really hitting the fan. And it is. But to make sure to stay focused on being able, what you can do, because there are things not only that you can do, but that we must be doing together as communities, as public health educators and experts. And that is, I think, the mental place as much as possible that we need to stay in, because we have a very short period of time to do a lot of work. And getting depressed and feeling disempowered is not the way to get that work done. And if you need help from friends and family and other folks, find it. It's there.
I don't think people realize how powerful they are on this issue, how the difference that they can make in their personal lives, in their families, in their workplace, in their communities, just by living an example of what a good life is and talking about it not as a super special issue. I rode my bicycle here. There are probably 5 people between when I walked in the front door and when I put in a little bike thing somewhere in this building that all, so you do that and you just say, hey, why are you doing that? A, it's healthier. B, it helps with climate change. So you can all do a lot, and now's the time.
And I would close on this note, and that is that something that I think is quite hopeful and quite advantageous for a group like this, and that is that people actually care about their health. The issue with climate change, when it's 100 years from now and it's all global and it's all around the world, what a group like this does, what health does, is it makes it about my health. I'm a foodie. I eat good food. I get exercise. Not me, but one gets exercise because we want to be healthy. We care about our children. We care about our parents and our grandparents. And putting it in that context of people, as you said, Bob,
Yep.
of caring, and that we can be proactive to live healthier lives, to be more aware and to be more informed. It can not only be informational, which is critically important, but also inspiring. So good luck inspiring people. You do it. we need it. So thank you all very much, and thanks to Bob and Sabrina.